So, hi everyone. This is Sanjana from Miara Health, and today we're very happy to have with us Dr. Amina Khalid. She's an OBGYN since the past 6 years. She's also done a course in IVF in Australia, and she deals with all aspects of women's health from preconception to post conception. And she also has a very interesting Instagram handle called Gyneca Health, so please do check that out. So, thank you, Dr. Amina, for joining us today.
Thank you so much, Anna. It's a pleasure.
Yeah. So
Right.
to so today we wanted to talk to you about the topic of postpartum health. So the fourth
Okay.
trimester, as many new the as people call it, is when new mothers kind of neglect their own health. So
Yes.
I wanted to ask you a few questions about this. For example, how
Sure.
long does it take for a woman to recover after childbirth, emotionally and physically?
See, every woman is different, so their recovery period also varies. And
Mm-hmm.
this is very important thing that you said, that women neglect the health. Once the baby is out means you just take care of your baby, and that's what the some places the society also thinks, like babies should be dealt with and the mother is totally neglected. Her recovery period is very, very important at this time.
Mm-hmm.
So basically, see, your body has taken 9 months to literally manufacture a baby.
Mhm, mhm,
So to go back to that pre-pregnancy state will take some time.
mhm,
So at the most, if everything is fine, if you do not have any high risk factors or any other complications,
mhm.
usually physically a mother should go back to almost her pre-pregnancy state by 6 weeks.
6 weeks. Okay.
Okay.
Mhm,
And yeah, that's when most of your organs have returned back to the pre-pregnancy state.
mhm.
But the whole process will take a little time, 2 to 3 months, but majority of it is done by then. And
Okay.
about the emotional aspect, it is quite an overwhelming experience, the baby, the whole motherhood, the new
Mhm,
responsibilities.
mhm,
So I mean, there's no period that, you recover. It's something you learn every day,
mhm, mhm,
about the baby, about dealing with the baby. So but yeah, one more thing important about that is, knowing about the postpartum blues and the depression in this case.
mhm,
That is one emotional factor that you should be aware of, and that
mhm,
is something your family should also take notice of. This is quite common. I mean, I think around 60-70% of women face these postpartum blues, irrational crying, feeling
mhm.
sad, for
Yeah.
no particular reason. You'll just start burst out crying at any moment, even
Mhm,
though, you might be aware that, yeah, this is something very stupid and why am I crying and all, but it's very, very normal and you should know that. Like a lot of women face this. So yeah, but this usually lasts by around 2 weeks.
mhm,
So if it is persisting beyond 2 weeks,
mhm.
that is some sort of a danger sign. That is like
Okay.
you're going into postpartum depression. So
Mhm,
that you should be knowing, and in case you feel that it's prolonging more than that, you should
mhm.
consult a doctor out
Okay.
regarding that.
Okay. That kind of brings me to the next question about what do new mothers generally come to you with? Like, what problems do they generally face in the first few weeks of after giving birth or first few months?
Mhm.
I'm sure it's a very
The
varied.
first few weeks,
Mhm,
yeah, it is quite a large topic,
mhm,
but yeah, most commonly, the first issue would be the bleeding issue. you know
mhm,
like how much am I bleeding. So
mhm,
basically you should, the first 24 hours are the time that you bleed more.
mhm,
After that, gradually the bleeding decreases, and eventually over a period of time.
mhm,
Okay. So yeah, there are some women who come, at around 14 days, sorry, 2 weeks around, that we had a huge bout of bleeding and my
mm,
bleeding has increased. Okay.
mhm.
But that is normal.
That is
Okay.
normal.
That is normal. Okay. What happens is when your placenta, the organ that has been supplying the nutrients and oxygen to your baby, that
Mhm,
comes out after the baby, right?
mhm,
So the area where that it was attached in the uterus, so that is kind
mhm,
of raw after birth. So it needs time
mhm.
to heal. So like
Okay.
how you get a wound, it's raw and there's a slough that forms over. That
Mhm,
slough has to come out. So
mhm,
that is what comes out at 14 days. The kind, you can think of it as a slough, or the area that has healed up, the placental side. So that
mhm,
is very normal. It will last around 2 to 4 hours.
mhm.
Not beyond that. It just subsides on its own. So don't get worried that I have had a huge bleeding suddenly out of nowhere. It's
Mhm.
normal.
Okay.
So that is one issue. So secondly, common thing is the breast engorgement that women face
Mhm,
because of the feeding. my breasts might become tender, they might become hard, they become
Mhm.
swollen. It's very painful to feed at such a time.
Mhm.
So you should know that you should be feeding every 2 to 3 hours, basically on demand if
Mhm.
possible.
Mhm.
Otherwise, at least 2 to 3 hours. And if you feel that the baby has had his fill, has
Mhm.
his or her fill, and your breasts are still heavy, you can always express it out. You can keep it out at a room temperature for about 4 to 5 hours. You can always give that to the baby later on,
Mhm.
but never let your breast become heavy. It can turn into an abscess, and
Mhm.
that is another whole scenario altogether.
Mhm.
So yeah, so that
So
is one thing. And yes,
yeah, go
the
ahead.
third thing, taking care of your wound.
Mhm.
Yeah, so taking care of your wound. Like suppose if you had an episiotomy, that's the cut given during a vaginal delivery at times, not regularly.
Mhm.
Okay, so taking care of that. There are a lot of women who don't even realize, that there's some infection going on over there. It's very, very necessary to take care of it, clean it, keep it dry, use the ointment
Mhm.
if it's given to you.
Mhm.
So take care of that basically,
Mhm.
or even your cesarean scar. So yeah.
Mhm. Yeah. So that kind of brings me to the next point about what when is it critical to see a doctor? Like there are some things like warning signs which a woman experiences and says, "Oh, maybe it's nothing," you know. So what are the
Mm.
critical period that they should definitely come? What are the
Mm.
signs?
So about this, basically, never think that it is nothing. If you don't feel it's normal, it's not normal. Okay,
Mm-hmm.
because you know your
Exactly.
body more than anyone else.
Mm-hmm.
So we tend to ignore our things. Yeah, okay, no, it's fine. Especially women, they just
Mm-hmm.
neglect their health, taking care of others. So no.
Yeah.
So if you feel something is not normal, consult a doctor online, whatever it is. So
Mm-hmm.
basically, see if you're bleeding. Firstly, if you
Mm-hmm.
feel that you're passing a lot of bleeding, you're soaking your pad every 1 to 2 hours,
Mm-hmm.
completely soaking it, or passing clots like the size of a golf ball, like this big clots if you're
Okay.
passing.
Mm-hmm.
Okay, that is not normal.
Mm-hmm.
Okay, so that is a warning sign. In case you are experiencing fever,
Mm-hmm.
um, that could be a sign of infection. If you are having there's some discharge from your wound, any
Mm-hmm.
pus, any redness,
Mm-hmm.
that again is a sign.
Mm-hmm.
Then besides this, in case you're experiencing headaches that
Mm-hmm.
is not subsiding with medications.
Mm-hmm.
Okay, if you're having any blurring of vision, if you're having any chest pain, so
Mm-hmm.
these things they tend to go, like some people they develop a bp, high bp, not necessarily during pregnancy. Some can present later on also. So these are some signs, symptoms for those: headache,
Mm-hmm.
blurring of vision, epigastric pain. Epigastric is just below your chest. So these
Okay.
signs you should look out for. These
Mm-hmm.
are the danger signs.
Mm-hmm.
So yeah, more or less
Okay.
that is what you should really look upon. So
Exactly. That's
yeah.
true. So what would help you as a doctor for diagnosis, for example? So if someone new, for example, comes, what would be important for the patient, for themselves, the new mom to track?
New ones, basically, you should just understand your body, what
Mm-hmm.
you're experiencing, your symptoms, in case anything is out of ordinary. And basically, when you come to a doctor, please do not hide something, even if it's something very silly.
Mm-hmm.
If I might feel, just tell it to your doctor. Okay,
Mm-hmm.
clear your doubts. Don't keep anything inside that. Yeah, what will she think? What will he think? What will my doctor feel? What am I asking? Don't. Every small detail in your history is very important to come
Mm-hmm.
to a diagnosis.
Mm-hmm.
So please give your complete details when you're telling to the doctor. They are
Mm-hmm.
sitting there to answer your queries. They
Mm-hmm.
are for you.
Mm-hmm.
So when you go, just be relaxed. No need to be, nervous or anything that I'm going to a doctor.
Mm-hmm.
Just chill and, just tell everything, because that is very important. We cannot come to a diagnosis until unless we know every aspect of what you are facing.
Or symptoms
Yeah,
that one
yes,
could
the
track.
symptoms. Yes, yeah. So anything you're feeling, you should just come and tell that,
Mm-hmm.
I'm facing this, or my pain has, suppose the pain, yeah, I'm tracking my pain. My pain is, instead of decreasing, it's increasing.
Mm-hmm.
That is not normal again. So
Mm-hmm.
yeah, you should note all your symptoms, and when you come, you should have a list. Yeah, this is what am I facing, what I need to ask, and that's how you should go about it.
Okay, that makes sense. What should they do during pregnancy that is important post pregnancy, like to get back into shape and stuff? Is there anything critical?
Nothing as such important, but yes, you should make sure that you're not gaining excessive weight
Mm-hmm.
during pregnancy, because shedding that off later, would be difficult later on.
Mhm.
There's this myth that, yeah, once you're pregnant, you have a baby, so you have to eat for two people. That's a very common myth, and it's completely a myth. It's not true. You should eat a balanced diet. You
Mhm.
should not excessively eat. According to your BMI, there are
Mhm.
certain weight gains that you should be having. But I'm
Mhm.
not telling you to go on a diet. In case you are overweight or something in a pregnancy, please do not crash diet. And yeah, I should not gain weight. That is not. Whatever is your weight, you should not, according to that, you shouldn't be overeating. Get me?
Mhm.
So what happens is, during pregnancy, it is also recommended you do a routine aerobic exercises, whatever you have been doing,
Mhm.
as long as there is no high risk factor, and after your consultation of your doctor,
Mhm. Right.
because you might be having certain conditions where we do not recommend exercises.
Okay.
If there's a placenta low lying, or if you are at high risk of preterm labor.
Mhm.
So all such things we do not advise. Other than that, you're always advisable to have some sort of an activity. So that keeps you fit during your pregnancy as well and later on. And see, postpartum, like once the baby is out, around 5-6 kgs you will lose just like that, because of all
Mhm.
the weight of the
Yeah.
baby, placenta, the fluid. So rest comes with the breastfeeding.
Mhm.
Once you breastfeed, the body, it burns calories to produce that amount of milk for your
Mhm.
baby. So
Mhm.
the more you breastfeed, that amount, you're burning that much calories. So you
Mhm.
are in turn losing some weight out there. So
Mhm.
give yourself time, basically. 6 weeks after that, you can just start routine walking, exercise, and gradually build up.
Mhm.
And about the weight lifting and all, that is one thing. Please do not lift weights heavier than your baby. Whatever is
Mhm.
the weight, you just lift your baby, not more
Mhm.
than that, for up to
Mhm.
6 weeks.
Mhm.
And after that, heavy weights only after 3 months. Body is still healing, even though you might be externally healed, your wounds are all fine, but your internal organs need time to heal up.
So another question I had for you is when could a woman resume sexual activity, for example, after pregnancy and post childbirth?
That's a very Yeah, that's a very important question. A lot of women think, but they do not ask this question. But you can always ask your doctor about it.
Mhm.
See, your body takes time to heal, and see, what you are feeling emotionally, physically, mentally might not be the same what the other woman is feeling. So if I tell you that, yeah, you can resume your sexual activity at so and so period, it is not valid for the other woman.
Mhm.
So minimum requirement that we say is again 6 weeks for this. That's the minimum time, since everything comes back to the normal state. But
Mhm.
if you feel that you need more time,
Mhm.
it's totally up to you. Whenever you are ready is basically my answer for this.
Mhm.
So when you feel like you're emotionally ready, whether you're physically healthy, if you feel the soreness has gone or this still persisting, you might not be ready, even though it's 2 months or 3 months. You
Mhm.
feel like you're not ready, it's okay. Just whenever you're ready. But yeah, minimum time frame should be 6 weeks, as
Mhm.
what we say.
Mhm. And what other advice would you have, for example, for new moms? So, what
Be
advice would
active.
you? Mhm.
Yeah, basically be active. No one's restricting you. In fact, even after cesarean and everything, you're expected to get up and move. The
Mhm.
earlier you move, the earlier your body recovers.
Okay.
So yeah, but it's just that do not strain yourself, do not exert over yourself, do not stress over it. Give yourself time, but do not be at complete bed rest sort of thing. No, be
Mhm.
active, be mobile.
Mhm.
And about the planning the pregnancy and everything, 2 years is the time we recommend, the time frame for planning
Mhm.
next pregnancy. So during that time, make sure that you're using proper contraception, because
Mhm.
even though you are breastfeeding and even though you do not you might not get your periods, but there
Mm.
are chances you can still get pregnant.
Okay. Mhm.
So yeah, so you need to be very careful. Like a lot of women will be like, yeah, I'm feeding the baby, so I wasn't getting my period. How can I get pregnant? It's
Hmm.
not that you can get pregnant. It's very important. Because especially if you have a cesarean delivery,
Mhm.
so your sutures on the uterus are very delicate and very raw at that time. If you get pregnant within, like 3-4 months again, it's
Mhm.
quite what do you call critical, I would say. It's we need to be very cautious with the next pregnancy then. So yeah,
Okay.
you just space out your pregnancy, use proper contraceptions. Yeah.
Okay. So, I mean, I guess what you've kind of said is, always consult your doctor if you have any doubts. Doctors are there to help you.
Mhm.
So I think that really makes sense. So,
Absolutely.
so I think we've covered quite a lot of topics. So thank you so much for taking your time. And
Most
do follow
welcome.
Dr. Amina's Instagram handle, Gyneca Health. And also
Yeah.
please follow
Thank you
Miara
so much.
Health.